Today's topic is pancreas. The pancreas is a soft, finely lobulated, and elongated exocrine and endocrine gland. The exocrine part secretes the pancreatic juice, and the endocrine part secretes the hormone that is insulin. The pancreatic juice helps in digestion of lipid, carbohydrates, and protein, whereas the pancreatic hormone maintain the glucose homeostasis. Location and description. जैसा कि मैंने पहले बताया, pancreas is a exocrine and endocrine gland also. It is situated on the posterior abdominal wall behind the peritoneum and lies in the epigastrium and the left hypochondriac region opposite level of T12 to L3 vertebrae. Now we will discuss about the parts of the pancreas. There are four parts of pancreas. First is head with uncinate process. Second is the neck of the pancreas. Third is the body of pancreas with a tuber omental, and the fourth part is tail. Here you can see this is the first part head with uncinate process. Second part is the neck. Third part is the body, and here is the tuber omental, and the fourth part is the tail. Now in the next slide we will discuss about the head of the pancreas. The head, it has three borders and two surfaces. The three borders are superior border, inferior border, and the right lateral border. And the two surfaces are the anterior surface and just behind the posterior surface. Now here this is the posterior surface. The head of the pancreas lies in the concavity of the C-shaped duodenal loop, and from the head there is a hook-like projection which runs towards the left, that is the uncinate process of pancreas. It has also two surfaces, anterior surface and the posterior surface. Now we discuss about the relation of the head of the pancreas. Superior border is related to the first part of the duodenum. This is the first part of the duodenum. And the superior pancreatico-duodenal artery. Inferior border is related to third part of the duodenum. This is the third part of the duodenum. And inferior pancreatico-duodenal artery. Right lateral border related with the second part of the duodenum, and anterior and posterior pancreatico-duodenal arterial arcades. Here, this is the location of the anterior and the posterior pancreatico-duodenal artery arcades. Anterior surface is related from above downward gastro-duodenal artery, transverse colon, root of the transverse mesocolon, and jejunum. Here, the part of the transverse colon. This is the root of the transverse mesocolon, and here the part is related with the jejunum. Now, the posterior surface is related to the inferior vena cava, left renal vein, bile duct, and right crush of diaphragm. And the uncinate process is related to anterior to superior mesenteric vessels. These are the superior mesenteric vessels which lies just anterior to uncinate process, and posterior to the abdominal aorta. The next is the neck of the pancreas. It has two borders and two surfaces. There are two borders are upper and the lower border. This is the upper border and this is the lower border. And the part is that is the anterior surface and this behind this is posterior surface. That's why it has two surfaces, anterior and posterior. Now we talk about the relations of the neck of the pancreas. The anterior surface is related to the pylorus. Posterior surface is related to the commencement of the portal vein. The upper border is related to the first part of the duodenum and the lower border is related to the root of the transverse mesocolon. The next is the body of the pancreas and its relations. The body of pancreas is the elongated part of gland extending from its neck to the tail. It passes towards the left of midline with a slightly upward and backward inclination. It lies in front of vertebral column at or just lower the transpyloric plane. Now we will discuss about the external features of the body of the pancreas. The body of pancreas has the three borders and the three surfaces. Three borders are anterior border, superior border, and inferior border. And three surfaces are anterior surface, posterior surface, and the inferior surface. And, it, and the body of pancreas also has a process that is the tuber omental, a part of body projected above the lesser curvature of stomach and come in contact with the lesser omentum across the lesser sac. Now we discuss about the relations of the body of pancreas. The anterior border is provided the attachment to the root of transverse mesocolon. Superior border is related to the celiac artery above the tuberomental. Hepatic artery to the right and the splenic artery to the left of tuberomental. This is the tuberomental. Towards the right side, that is the hepatic artery, and towards the left side, that is the splenic artery. Inferior border is related to superior mesenteric vessels. This is the inferior border related to the superior mesenteric vessels. Anterior surface is related to lesser sac, stomach, and the posterior surface is related to aorta and origin of superior mesenteric artery, left kidney, and left suprarenal gland. This is the left kidney and the left suprarenal gland is the aorta and the commencement of the superior mesenteric artery. The splenic vein usually lie in a groove below the level of splenic artery. Inferior surface is related to duodenojejunal flexure, coils of jejunum, and left colic plexus. Now, the tail of the pancreas. The tail of pancreas is the narrow left extremity of the pancreas. It means it is the left end of the pancreas and the right end of the pancreas is the head. The tail of the pancreas lies in the linorenal ligament along with the splenic vessels. This is the linorenal ligament and the splenic artery. The tail of the pancreas is mobile, unlike the other major retroperitoneal part of the gland. It contains the largest number of the islets of Langerhans per unit of tissue as compared to other part of the gland. Relations of the tail of pancreas. It is related to the vessel surface of spleen between gastric impression and the colic impression. Now, the ducts of the pancreas. There are two ducts, the main duct of pancreas and the second is the accessory pancreatic duct. The main duct of pancreas begins in the tail and runs along the length of the gland and receiving numerous tributaries on the way. It opens into the second part of the duodenum at about its middle with the bile duct on the major duodenal papilla. This is the tail. This is the commencement of the main pancreatic duct and it runs along the pancreas and receives the numerous tributaries and it opens by combining the bile duct and open at the major duodenal papilla in about middle of the duodenum, second part of the duodenum. And second is the accessory duct of pancreas. Accessory duct of pancreas, when present, drains the upper part of the head and then open into the duodenum a short distance about above the main duct of the minor duodenal papilla. This is the accessory pancreatic duct of Santorini, which is lies just above the major duodenal papilla. Arterial supply of the pancreas. The pancreas supplies by the splenic artery, superior pancreatico-duodenal artery, inferior pancreatico-duodenal artery, and the pancreatic branches of the splenic artery. And corresponding vein drains into the portal system and lymph drainage situated along the arteries drain into celiac and the superior mesenteric lymph node. And the nerve supply of the pancreas is autonomic nervous system. Thank you.